Welcome to Native Bidaské, Native News Online's weekly spotlight on people making news and leading change in Indian country. My name is Levi Rickert, publisher and editor of Native News Online. This past Sunday, in a historic vote, the U.S. Senate approved the Inflation Reduction Act, which aims to lower emissions contributing to climate change, bring down prescription drug prices, and address inflation. Today, we have a very special guest. It's Aaron Payment. He's the Director of Government Relations at the National Indian Health Board, based in Washington, D.C. He will give us insight into how the IRA, as the Inflation Reduction Act is called, will impact Indian country. Welcome, Aaron, to Native Bidaské. How are you today?
Nee, bonjour. I'm doing really good. Mino Gijagat. I'm very happy today.
Well, first of all, I want to ask a question. Is the National Indian Health Board, are they pleased with the overall act itself, the Inflation Reduction Act?
Yes, absolutely. So, NIHB is nonpartisan. So we monitor and track legislation that benefits tribes. That's our main objective, what will benefit tribes. And so, we're using the IRA already, and that means something different to Indians, right? That
it really does.
Act. But these are really kind of some of the key elements or vestiges in the Build Back Better that have made their way through. And so we're grateful for the environmental provisions. Tribes, as the natural stewards of the land, know that we are not separate from our Mother Earth, and that water is life. And so, and also that we have this existential threat to our very existence that we have to address. And so there are some key elements in this legislation that will begin the process. So it's obviously not what we really wanted in the end, but all of those things affect public health. But then there's some specific benefits related to health that are generally applicable to all Americans that will specifically benefit American Indians because we happen to have the worst of the worst outcomes. Diabetes, heart disease, and cancer is emerging as a threat. And so there's general provisions that are beneficial, and then there are specific provisions that are targeted to benefit American Indian tribes.
Now, I mentioned it passed the House, and it was a 50-50 vote, and Vice President Harris was able to cast the deciding vote. And so some of us are really pleased about that. What's your feel at the National Indian Health Board? Do you feel like it's going to pass today in the House?
Yeah. So the Senate, when they did their part, it took everything to get the two holdouts on the Build Back Better to agree. And I'm just grateful that they did. The social commentary here is that industry has a real strong impact on what Congress is willing to do or not do. And, the really big picture here is at some point, industry is going to recognize the opportunity that transitioning to a green world, a greener environment, will represent. And so the jobs that are going to come for clean energy, all of that will make it clear that we're transitioning, and there's going to be jobs and opportunity and income and profitability on the other end of it. So the Senate did what they had to do to get the two holdouts to agree. And so Nancy Pelosi runs a tight ship on the House side, and it's not likely that we're going to see anything that would disrupt what the Senate has already passed, because if there are significant changes, then it has to go back to conference. And I think that there's so much expectation that this passed today, and that it not go back for ratification so that different senators can rehash. It passed with 100% Democrat support, no Republican support. And so I think the House is going to be very cautious to pass it today, and that the president may even sign it before the end of the day.
That'd be great. And tell me this: some critics have claimed the bill has not gone far enough. What's your thoughts on that, Aaron?
Well, so, from an American Indian perspective, we can easily agree with that, because there's more that needs to be done to protect against climate change. You have tribes in the Northwest that are actually losing their entire reservations through erosion and soil erosion. You have California tribes that are battling wildfires that's threatening their existence and relocation. You have droughts in the West that are significant and far accelerating in past what people previously predicted. And so this is serious. I serve on the president's ad hoc 30 by 30. I started out when I was tribal leader, but I got to continue, which I'm excited about. And the President's America the Beautiful initiative and the 30 by 30 is to move and protect a percentage of public lands by 2030. And so included in this legislation is to address emissions and to reduce emissions by 30%, no, by 40% by 2030. So those are really big, but there's a lot more in the transitioning and creating incentives for auto industries to move to electric. And but there are really solid provisions. And to me, we can't move fast enough. And as an American Indian, we can't move fast enough because these threats are real. They're saying that some of the climates that we're living in right now, that we can basically like draw a map 500 miles south of where we live. And in 10 years, that's the climate we're going to live in. And I live in a nice, cool environment. I joke that I have an extra layer of Ojibwe fat to survive the dead of winter. But I like my climate and I like my seasons. And I have to move to Washington, D.C., so that's going to be interesting. But it's already hot enough there. We don't need it to be 500 miles hotter. And so there's a lot more we should do, but this is a good start. And I'm optimistic because we're moving in that direction. I think some of the incentives for transitioning, some of the industry incentives are going to get us on the path where auto industry is going to recognize that there is profitability on the other end of this, and people will start transitioning. There's rebates and credits for going solar. And so I think it's going to be a really good kickstart to prove that that we aren't going to collapse as a society as we go green.
Mm-hmm. But talk about the health provisions. I know that I was, in regardless if you're native or not, especially for senior citizens, the insulin cap of $35, and on the high side, we understand that some people pay up to $1,200, which is a significant amount of money. I don't care where you are in the economic strata, $1,200 is a lot of money. And what's your thoughts about that, and how's that going to help Native American elders?
Yeah, so one thing you and I have talked about many times is the challenge that seniors and elders have with trying to decide how they're going to be able to afford to buy their medicines. And if you're lucky enough to be an American Indian that lives in your purchase and referred service area, previously it was called contract health area, then you can get your prescriptions through your tribal health delivery system. But the vast majority of our people do not live near a tribal health center. And so that's just a reality. That's something that I've been a drum I've been beating for years. But lowering the costs from, the average I think I saw was $665 to $35 a month. That's huge. Think of the difference in those elders being able to keep that in their pocket. For people that are living on Social Security, that's almost their entire check. And so that's significant for seniors and in particular for our elders. But the other really big part that I appreciate is over the next 2 years, I think, it will cap the total out-of-pocket expense for Medicare to $2,000. And so whatever prescriptions, if it's chemotherapy, then it's gonna limit those expenses to $2,000 annually. And that's a huge savings for our elders as well.
Yes, and I was Sunday. I was actually last weekend because they played out. There was a long session for the Senate, but I was really taken back by the strong lobbying groups that were just of the pharmaceutical companies really lobbying to take out that provision for all Americans for this insulin, and it shows the power of lobbying. And but I am happy as it turned out, especially for seniors, because as you mentioned, you and I've talked about it many times, and we've been in meetings where elders basically have to choose between putting food on their table or getting their insulin, and so the $635 is pretty significant.
If we go back in time, and I'm older than I look, but if we go back in time, Hillary Care, what killed Hillary Care when she was First Lady and she drafted up healthcare reform was the pharmaceuticals and capping costs for medical procedures. When we perceive medicine as an industry, as a profit-making industry, rather than as a right, and for us uniquely as American Indians, we traded 500 million acres of land in exchange for health, education, and social wealth. Health is first in that promise, right? And if you don't have your health care, you don't have anything. But it was the pharmaceuticals that killed that. The draft of that bill, of that language, was an excellent move forward in public health. The other area that I appreciate is the extension of the ACA subsidies, which will last through 2025. And so one of the shortcomings, I was asked this question by somebody earlier today, is that American Indians should be automatically enrolled and eligible for the ACA and the Medicaid expansion. And so we do have, and we're treated differently than other Americans in that we have open enrollment. So American Indians can sign up for the Medicare expansion no matter where you live. No, that's not true. Some states have still not expanded, and I apologize for that. But American Indians can sign up anytime. But we are means tested when we sign up. So you may have to pay something towards your insurance. It's still worth it, but we shouldn't have to pay anything because we prepaid with 500 million acres of our territory that we ceded to the federal government. So one of the shortcomings, although I appreciate the additional subsidy, is I think there's still work to do with the administration or Congress to qualify American Indians for healthcare no matter where you live. And so one of the messages that I keep pushing out is we need portability. We need IHS portability, just like veterans portability, so that if you're an American Indian, you have an insurance card, an IHS insurance card that you can use anywhere you live. And so the ACA might be the pathway to get that done.
And Aaron, I'm going to pivot real quick because I just came back from the Midwest Alliance of Sovereign Tribes and used to be president of that group. 2 days. I heard this conversation was so disturbing, and it was about the drug abuse on our people. And we know it's not unique to Native Americans. We know that because opiate addiction is a problem nationwide. But one of the concerns that one of the tribal leaders brought up, and somebody from IHS was there for regional out of Minnesota, and he had a slide that said that I want to say it was like $40 million given to hepatitis, but only $9 million for drug abuse. And they feel like the tribal leaders are saying that they felt like that's kind of lopsided, that it probably should be flipped, because whereas there is a hepatitis problem among Native Americans, drug addiction is real. And we know that sometimes you can even connect the dots between the historical trauma and our drug abuse associated with Indian boarding schools. And we here at Native News Online have done, as you well know, about 140 stories on Indian boarding schools over the last 14 months. But when I go to conferences and meetings like I did this week, I sometimes wonder if we need to really reevaluate. Now, obviously, we're the Indian boarding school coverage is very, very important. We understand that because this needs to be out in the open, what happened to our people. But our kids are dying on our reservation from drug overdose. Tell me what the National Indian Health Board is doing to address that issue.
Yes. Well, first, let me say that I am so appreciative to have the opportunity to continue to do some of the stuff I've worked on previously when I was tribal leader. When I was tribal leader, I was on the SAMHSA Tribal Advisory, on the HHS Secretary Tribal Advisory, on NIH. I was the Tribal Advisory co-chair, Office of Minority Health, Health Research Advisory Council. So this is a space that I've worked in. We've made great headway on getting an increased proportion of a set aside out of the tribal opiate response funds that have come through. And we obviously need more. And one of the things that I say is that as long as middle-class Caucasian people are suffering from the opiate addiction, the money's going to flow. And this is a national crisis for all racial ethnic populations. We teeter from being the number one impacted subset of Americans. And it is because of historical trauma. It's because of tribal critical race theory, which pits us in environments where we have less opportunity. Tribes have been able to ameliorate a good portion of that through our own economic development and our casinos. But this is huge. And the drug trafficking knows no boundaries. It doesn't know jurisdictions. It goes wherever there is opportunity to flourish, just like a disease and a festering disease. So the National Indian Health Board was focused pretty acutely on this epidemic. Long before the pandemic, we had the epidemic of the opiate crisis and drug addiction. And we unfortunately have the worst statistics for our adolescent population. Out of any population, we have the very worst. And so reshifting our focus to the historical intergenerational trauma and the impacts of creating the environment that perpetuates addiction. So one thing that we're doing at the National Indian Health Board is next week on the 16th of August, we are holding a virtual summit, Health Equity Summit. We're grateful that the president and this administration is focusing on equity and on health equity. It's kind of still undefined. And so we are holding a conference where we're bringing Dr. Malia Villegas, who used to be with the National Congress of American Indians, and she is an expert in data and health, along with Dr. Brian Brayboy, who will explain tribal critical race theory. And we're putting those two together because we're going to make the connection between what happened in federal Indian policy and then the evidence in the Broken Promises report and the statistics, and then the perpetuation of it through tribal critical race theory. Once we understand that flow, that chain of events, then we're going to be able to fashion interventions and solutions. And so we're doing our best to try to crystallize the focus on looking for solutions by understanding the problem and unpacking the impact of historical and intergenerational trauma.
Yeah, and I think what you said is, I really appreciate that, because to me it is about connecting the dots. And I was talking to a friend, I said, well, maybe we need to back off the Indian boarding school and really zero in on today's crisis. And they said, no, it's all connected, and always remember that. And I think that is so true. And so I appreciate what you just said. It's really about connecting the dots and dealing with it. Now, with the Indian boarding school, you and I'll both be up in Pellston, Michigan tomorrow, in the lands of the Little Traverse Bay bands of Odawa Indians. And Secretary Holland will be there from the Interior. Assistant Secretary for Indian Affairs at Interior, Brian Newland, will be there on the second stop of the Road to Healing tour. One of the things that I think it is coming out of this is, as we hear the stories from the survivors, is that there really needs to be some really intensive mental health as part of the counseling, or as part of the healing process. What's the National Indian Health Board doing in terms of ensuring that the dollars will be allocated towards mental health?
So first, let me say just how proud we are that our nation's first American Indian secretary followed through, because she had legislation when she was a congressperson to move in this direction. And then also for the report to have been authored by Brian Newland, who grew up just 20 miles from where I am. I remember when he was an undergrad at Michigan State. and just how proud we are of him to get this across the finish line. This report was very critical of federal Indian policy. And often when you see these kind of commission reports, they're kind of sanitized or whitewashed or made safe for people to read it, right? But this was not. This was raw, and it's the first step. So I really appreciate the honest approach that this administration, especially Secretary Holland and Assistant Secretary Brian Nolan, on that report. But let me say then, previous to my current role, when I was chairperson and on STAC, I was the voice that was the loudest with Secretary Becerra on reminding the secretary that we need to be prepared for this, because what's happening is we're seeing a social transformation. Some of us have been in this space for a long time. My master's thesis in 1991 focused heavily on the boarding school experience, and it took me 2.5 years to write that section because I would cry and I would have to go put tobacco down and pray. But I very loudly advised the secretary of HHS that we need funding, and there is funding drafted in the president's budget for this. And so let me also echo Chairwoman Regina Gasco Bentley. She's my good friend, and she's the chairwoman of Little Traverse Bay Band, and she is a survivor. And when we first start talking, she said that she in the past never talked about it because it was too painful, and it's very private. So she never talked about it, but she told me that she knew she had to be brave and start talking about it because it will help other people to process through it. But one thing that's always on the forefront of her mind is the sanctity and the wellness of our elders and the people who have kept these secrets because they were taught that they were dirty or that they were bad, dirty Indians, and that they were bad. That was ingrained in them. And a lot of this is recessed in the back of their memories. And so when young people, especially when they become woke to these issues and they become a little strident, and we're excited because, it shows that our movement's not dead, right? The American Indian movement is alive and well today. But when in our advocacy, we just have to be balanced to remember that other people are victims, and that the more we push, or if we don't push in a balanced way, it could put people in a position where they become desperate. And so we need to be mindful. And I'm grateful that Little Traverse is offering counseling on site, and they're going to have counselors available for people to be able to talk to. And I would ask everybody that hears this message, as your elders are processing through this, make sure that you're close to them, that you're talking with them, that you're praying with them, that you hug them, because they're going to be unearthing some real painful memories. And some of it, they're going to remember things that they didn't remember before, things that they witnessed. And so we just need to be very humanistic about how we go about this and make sure that our people are well through this. It is a necessary step to heal through this part of our history so that we can come out the other end. We are resilient people. We've dealt with it. We've survived this, and we're going to survive this too, and we'll be stronger as a result.
I agree, and thank you for those comments, Aaron. I too echo what you said and how proud we are of Secretary Holland and Assistant Secretary Newland. I've written that I doubt a non-native Secretary of the Interior, typically a white male, would have even gone as far as establishing the Federal Indian Boarding School Initiative and then coming out with the report that the federal government for the first time admitted to a whole lot of things. And so it is a time of healing. And to our listeners out there, our viewers, is that as we were talking about the drug use across Indian country, and we know it's not just unique to Indian countries. As Aaron said, it's white suburban people are suffering from opioid addictions, but we've got to challenge our young people to really go for the opportunities that exist for us today. I jokingly, and I actually had a speech that I've given, this never been a better time to be American Indian then I go ... since Columbus. But I just think that we do live in the era that there's a lot of opportunities, and the Biden administration, for those who don't know, this has been one of the most helpful, and that's the word that came to my mind, helpful to Native Americans. There's just no two ways about it. So we're pretty excited. Keep up the good work you're doing, Aaron. I look forward to seeing you tomorrow. Thank you very much, Chi Miigwech, for coming on, Native of Bidaské. And I know we kind of pivoted. We started talking about the Inflation Reduction Act, and we talked about a lot of other things, but you're so knowledgeable, and we hope to have you back soon. So
thank you. Glad to be here.
Yes. And to our viewers, if you appreciate what we do here at Native News Online, we invite you to donate to support our continued coverage in Indian country. You can scan the code on your smartphone or go to the link located below this video to donate today. We appreciate your support. Please be sure to subscribe to our YouTube channel and follow us on Twitter, Facebook, and Instagram. And be sure to subscribe to our newsletter. Thank you again for joining us today, Chi Miigwech. Please be sure to join us next week for another episode of Native Bidaské. And I have rumor that we're going to actually have a cast member from Reservation Dogs next week. So make sure you come on next week at 12 noon on Eastern Daylight Savings Time and check out Native Bidaské. Chi Miigwech. Have a good day, everyone.